right, we are starting this hour. We're so excited because we're going to be speaking to Yvonne Thuo. Yvonne Thuo, have you ever had a sick person at home? Umekuwa na mgonjwa as in nile ita anashinda kienda hosi akirudi hosi eventually inakuwa yani you're spending so much money in the hospital. Even the hospital will tell you wacha atritiwe nyumbani. Utaanza wapi? Wendi utacha job yako utekea vye ama utapata nasu wapi?
Ama unachukua sijui kazi kutoka ushago
akuje. Alafu kidogo mnaona zile videos za people being mistreated. Have you seen those videos? Man, I hate them. All right. So Yvonne Thuo, what kind of work does she do?
She's a home care based giver. So na make sure as long as uko kwa nyumba you'll receive your medicine on time. Doctor visits itakuwa on time. Food of course itakuwa prepared on time.
All right. So this is definitely a conversation we need to have. On My Grind starts now.
Good vibes only on Vibes Radio.
Yourself wherever you are. On My Grind begins now. To invite our special guest to the conversation.
She's the director of marketing and partnership at a company called Utunzaji Home and Nursing Care. Welcome, Dr. Yvonne Thuo.
Hi.
Hi, thank you.
Welcome to the show.
Thank you. It's a pleasure to be here.
We are really grateful that you're taking time out to speak to us about what it is that you do. Now, we want to get right into it. What do you do?
At Utunzaji Home and Nursing Care, we bring health services to the patient. That means we offer home-based health services. So if you need a doctor's visit or a nurse's visit or nursing care, or a procedure such as wound care, we bring that service to you at your convenience.
Who are your main customers right now, especially during this COVID period? Do you have guys, let's say, who can't go to the hospital due to diabetes, due to cancer? Who are your main patients for now?
Yes, we have mainly the elderly, the old patients. That's from the age of 60 and above. Especially those ones who have challenges moving around. Maybe they're not very fully mobile. Then we also have patients who have diabetes, patients who have other medical illnesses who don't really want to go to the hospital because of COVID. And then we have those patients who just need the convenience of being attended to at their home or office.
So let me get this straight. So like if I wanted, maybe I don't know, maybe I had to take some medicine and I didn't want to go to the hospital, I can call you guys to come and give me the service at home?
Exactly.
And is it just nurses or is it doctors, nurses and so on and so forth?
It's a wide variety, including even lab. We offer home lab services. We can come to your home, pick the samples for free. You only pay for the lab test. We do the test and then we get back to you on what the results are. We offer ultrasound at home. So even antenatal ultrasound, even other kinds of ultrasound. We have a doctor we work with who can come to your home and do the ultrasound. We offer physiotherapy, occupational therapy, and even counseling.
Wow. I mean, it's very interesting, especially your samples. We're going to take a short commercial break, Yvonne, as we come back to this. Brayo, hii story ya kuchukua sample. Unaenda tu kwa hospitali unasema, my stomach is aching. Anakuambia, haya, chukua hiki kikombe, enda huko ndani kwa hii toilet na uache hapo nini sample. Unamwambia, lakini sasa sisikii kwenda kwa choo. Basi unakaa kwa hosi hapo, sasa uko tu kwa hosi, una aim. Before you know it, tunapeleka hiyo sample kwa lab. Wanakuambia hapana. So I like that you give this service at home. Ndio yani nipunguze aibu. We're going to come back with this.
Good vibes only on Vibes Radio.
Morning Vibes. This is the show, and of course, you are the MVP, and you're the reason we're here to serve you nothing but good vibes only. It's your captain. They call me Kwambox
and Mbunde here in studio.
And I'm so excited because we're having a conversation on My Grind about home care, nursing care, especially for it's basically compassionate and affordable health care at your convenience. And we've got Yvonne Thuo, who's here to speak to us about what it is that they do.
So, Dr. Yvonne, how did you guys go about starting this business? See, is it because doctors are not paid that much? Ama muliamuaje?
Well, the motivation for us was that we saw a gap.
Yes.
You get a patient comes from the hospital and they go home, but they don't know exactly what they should do. They don't know how to do it. And that makes their recovery slower. So they come back to the hospital with complications. So we decided to make a difference, to intervene.
Okay.
So we not only provide the services, but we also educate the patient and the family, and we work with them in this journey of recovery.
Who are the first people that you reached out to when you were starting Utunzaji home and nursing care?
We reached out to our network first, our family and friends, our colleagues. We are also quite active on social media, so we reached out to the larger public.
Yes.
And we also have a website up.
And right now during COVID, doctors and even the Ministry of Health are suggesting that guys should stay at home, especially if you're feeling unwell. They're suggesting that going to the hospital should be like the last option. How are you guys approaching this situation? Because you see, chances are very high that you guys are now getting exposed to the disease, COVID.
We take all the standard precautions when we do our home visit. So our staff are in the mask, they're in protective gear, not the hazmat suits, but they're in the protective, standard protective gear. Hand washing, we keep that distance as much as is practical. And we also have a package for the COVID positive patients, actually. A lot of patients don't know what to do. Okay, you've been told to stay at home because you have COVID. What does that mean? What should you do in your home? How do you protect your loved ones? We come in there and we work journey with them.
Have you guys experienced a surge, especially right now during COVID? Because you see, right now is when guys are saying there's some diseases which were not guys didn't know that they had certain diseases, but right now due to COVID, right now is when guys are discovering, I had diabetes, oh my god, I had other underlying issues happening in my body and I didn't know. Do you have a surge of guys actually now reaching out to you guys?
Yes, even with COVID, sometimes COVID can come with sugar problems. So someone says, I wasn't diabetic, but now I have this problem.
Yes.
Then I think COVID has also made people to be more aware of their health needs and to want to have their routine checkups. Do I have hypertension? Can someone check my pressure? Can they tell me what that means? So definitely, yes, it has created a lot of awareness of the need for us to know our health state.
And Yvonne, I have to ask, on your website, you speak about compassionate and affordable healthcare at your convenience. A lot of the people who are listening right now are scattered all across the country. Where are you located? Where, if I say I have a patient in, it's my grandmother, and I want the care to be done in, say, Kisii, is that possible?
Yes, actually, the thing with Utunzaji is that we offer our services all over Kenya. So our offices are located along Ngong Road, on 5th Ngong Avenue C, but most of our clients don't come to the office. They ask us to go to them. And we have partners and a wide network of healthcare service providers that we work with. And that enables us to work anywhere in the country. So far, we've attended to clients in Garissa, in Kitale, in Nakuru, in Gatondo. Yes. Even in Oyugis. So yes, we absolutely can provide services in any part of the country.
And I know this is a bit of a weird question, but what is that one disease that is most common that you treat?
Well, so far I would have to say diabetes and hypertension. They're pretty common.
All right. We're going to come back with Yvonne Thuo. Of course, we're learning about Utunzaji home and nursing care. If you've ever thought of taking care of a loved one, especially when they're sick, you know that is it's hectic. It's hectic. And most of the times families choose to, you don't go to work, you stop your school so that you can continue taking care of this person.
Yes.
But sometimes you just need professional help. And that's what Utunzaji Home and Nursing Care do. When we come back, more questions. Remember, you can ask your questions on hashtag VibesMVP.
Good vibes only on Vibes Radio.
Matete, reggae from the 254. Oh, so sweet. No Retreat is the name of the song, and it's playing right here on Morning Vibes. There's some pressure coming through. Pressure ni mnoma. Ngoma yake Love and Affection. Noma sana. 8:30 is the time. We will give you your third update, traffic update, so do not touch that. I'll keep it right here. But this is Morning Vibes, where you come to catch your daily dose of good vibes. I'm your captain. They call me Kwambox.
And Mbunde here in studio. And this hour is all about all my grind between 8 to 9 a.m. And in studio hapa kwa Skype tuko na Dr. Yvonne Thuo, who's the Director of Marketing and Partnerships at Utunzaji Home and Nursing Care. Hi, Yvonne.
Hi.
Welcome back. So we want to get, in case there's someone who's listening in right now and they want to bring their loved one, what's the procedure? How do they go about it?
It's as simple as giving us a call.
Mm-hmm.
We'll guide you through, we'll get the details, we'll do an assessment, we'll discuss the patient's needs with you, and then we get on board. You give us a consent to go ahead and we get on board.
Okay. And do you even at least give someone a quotation? Ndio mtu asifaint aseme hivi yenu.
Definitely. We are very affordable.
Yes.
And we adjust.
Okay. And
there are patients we get who can't afford the standard charges. We adjust.
Okay. There's a report that was shared to media houses about hospital beds filling up due to a surge in COVID-19 patients. From your side, are you guys, let's say, like prepared in terms of knowing, by the way, this and this as a treatment that kama mtu ako kwa nyumba, you should try out this type of medication so at least you can sustain for some time?
Yes, definitely. Okay, home care for COVID is for patients who have mild symptoms. So it's not for all patients. So for these patients, it's basically eating a good diet, a balanced diet, drinking lots of water, exercising, taking care of your mental health. You can take supplements, the antioxidants, idawa, the ginger, lemon, and honey.
Yes.
Or you can take it in the form of tablets. Basically, it's just loading your body with the nutrients.
Yes.
And taking care of your mental health.
Okay.
And then giving it time.
Let me also ask, Utunzaji Home and Nursing Care has been in existence for how long?
We are very young. This is our second month.
Wow.
Oh wow! So did this come out? Did this come about because of COVID?
Yes and no. One of our directors was already doing home care under a different name. So we joined him, we came on board. He's been doing home care for the last 8 years. So he comes with a lot of experience.
Yeah.
And then, yes, because of COVID, because personally, as a doctor, I saw that there were a lot of complications. You see a patient coming in with complications that are preventable because when the lockdown occurred, people didn't have the necessary access to healthcare.
Yeah.
For various reasons. Yeah, so they would come back very sick. And to me, it was very heartbreaking.
Yeah.
And we said, let's do this. Let's go to them. Let's go to these patients who can't come to the hospital.
And let me ask you, there's of course a lot of people are tuned in right now going like, okay, why should I choose you guys over my cousin who is doing absolutely nothing in Ushago? Why should I choose you over them?
Healthcare is a skilled service.
Yeah.
So someone has to have the skills to provide that healthcare. We work with people who are fully competent, fully trained, and over and above that, who are very compassionate.
Yeah.
We are founded on Christian principles, actually. So for us, we believe in giving our best at all times and in putting the patient's needs first.
Yeah.
Then your cousin from Ushago doesn't have the knowledge and the skills that are needed to take care of a sick person.
Okay.
And we find this is what I was calling the gap, the information and skills gap. So if you're not able to afford to hire a nurse from us, for example, we can come in and teach you what you need to do. We give you that training. Yes, we call it mentorship. We teach you, we tell you, for this patient, you need to do this. You need to turn the patient every 2 hours. You need to buy this. You need to feed them this. We come and give you that, that knowledge and give you some skills as much as we can. Yeah.
Imagine a scenario where there are people who are listening to you right now and they're like, okay, I do have a sick person at home. I cannot afford you guys, but I do want to access the mentorship. Is it possible to how else can someone access the mentorship without necessarily you guys going to them?
Well, we can offer teleconsults. We can actually mentor someone remotely. But the ideal thing is to go there and assess, because when we come to your home to assess, we assess the patient, but we also assess the home environment. You see, so we are very holistic.
Yeah.
We'll even tell you here, you may need to do this and this adjustment. Yes.
All right. We got to take another short commercial break. Yvonne, do not go anywhere. And for those of you yani mnajua mko ndani, tumia hashtag vibes MVP. Kuna swali yote unataka kuuliza Yvonne. You're probably sitting there and you're like, ai, wanatreatingi disease zote ama kuna zingine zenye watakata? Ni gani hiyo? Siulize.
Morning Vibes, where you are the MVP. No negative vibes.
Yes. All right. On the line, we've got Yvonne Thuo. Of course, we're having a conversation about home care, home-based care, especially for people who are sick, for invalids.
And she's from Utunzaji Home and Nursing Care. So, Dr. Yvonne, welcome back.
Thank you.
There's another report that I've remembered that stated that especially during this period when guys are losing their jobs, there's an increase in terms of the number of suicides happening out there. Do you guys offer mental wellness talks and even counseling from home, at least so that people can just talk it through?
Yes, absolutely. We offer counseling as one of the services. And not only counseling, you can also talk to us. We will walk the journey with you. We also work with several mental health providers. We have several psychiatrists on board. We have psychologists and counselors on board. And home care is not only for, that person who is sickly. It's for everyone. Yes, it's for everyone. We offer what you will get at a hospital. We can bring it to your home, with a few exceptions, of course. There are those things we can't do at home.
Yes.
Because I was like, fanyaje X-ray.
X-ray nayo ni tricky, but ultrasound tunafanya.
Ultrasound kwanza ni vizuri sana. Na stool sample nimefurahi sana kusikia kwamba mnachukua kutoka kwa nyumba. It's very disorienting for some of us.
Na kuzaa, unaweza saidia mtu kuzaa kwa nyumba?
Home deliveries ni possible. Zimekuwa zikifanyika. So far we've not received a request, but yes, for specific patients.
All right. And I know that during COVID, one of the biggest challenges, the biggest group of people who were affected were pregnant women. Because they couldn't access maternity, they couldn't access their doctors. Some were even giving birth at home with their husbands helping them out. And so you, at this point, for someone who maybe is listening, are you saying that you also do, if someone wanted to give birth at home, you would be the number to call?
The ideal home delivery should be a planned home delivery, so that we can assess the mother for any risks that can occur if they deliver at home. However, if you're caught in an emergency situation, call us.
All right. I know that we're about to wrap up. I know that all your contacts are on the website, but just for clarity, if someone wants to reach out to you, maybe, I'm feeling, my joints are aching. I don't want to leave the house. I want you guys to come over. How do I go about it?
Okay, so you can reach us on any of our phone numbers. That's +254 110 099 348. +254 731 859 066. +254 734 650 151. You can also visit our social media pages. We'll respond to you. Yes.
What are your social media handles?
Utunzaji Home and Nursing Care on Facebook, on Twitter, on LinkedIn, and on Instagram. And our website is utunzajihomeandnursingcare.com.
Let me also ask, do you guys take insurance?
So far, no, but we're in the process of doing that. Most insurance companies, you can get the service from us and then they pay you back. You pay us and then you get the money from the insurance company.
All right. And of course, we got to end the conversation there. Thank you so much, Yvonne. Learning about Utunzaji home and nursing care. We appreciate you. For those of you, and do have a great day. I know you have to go to work. Do have a great day. Thank you so much for hanging out with us this morning and enlightening us on the work that you do. For those of you who are tuned in, remember you can visit their site utunzajihomeandnursingcare.com. Kama kuna maswali ama unataka kujua ni nini wao fanya ama you want to just find out more about them, the website is utunzajihomeandnursingcare.com.
Good vibes only on Vibes Radio.